Good evening, ladies and gentlemen. This is Dr. Nishant Sharma, your moderator for the evening. I welcome you back to another episode on this virtual series of discussions for arthritis in India, a nationwide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we talk about different management strategies of arthritis. We try to understand what arthritis is, the different types of arthritis, where we will talk about the prevalence, about some common myths and misconceptions that our community has around arthritis, about the public health initiatives, and some preventive measures for all the individuals out there. So without further ado, let's delve into the conversation. Allow me to introduce my panel experts right now. Dr. Shah, Waliullah, Additional Professor, Department of Orthopaedic Surgery, King George Medical College, Medical University, Lucknow. Good evening, Dr. Shah. Thank you for joining us.
Good evening. Thanks a lot for your kind invitation.
Thank you. We have with us Dr. Yogesh, Preet Singh, Senior Rheumatologist, Himalayan Institute of Medical Sciences, Dehradun. Good evening, Dr. Yogesh.
Good evening, Nishan. Good evening, and thanks for the invite and giving the opportunity to be part of this panel discussion.
Thank you, sir. And we have with us Dr. Anuj Dhingra, orthopedic surgeon at Vedantaa Hospital, Faridabad. Good evening, Dr. Dhingra. Thank you for joining.
Good evening, Nishant. Thanks for the invite and to be part of this session.
Thank you, sir. So without further ado, let's just delve into the conversation that we are having. So our first section of discussion is going to be understanding arthritis. So I'll start this with our senior rheumatologist here, Dr. Yogesh. Dr. Yogesh, give us an overview of what is arthritis and the different forms of arthritis that are prevalent in India.
So arthritis is a general term. It is, you can say it is symptom of condition. So wherein individuals with this condition can have joint pain, joint swelling, and difficulty in moving the affected joint. And it is not a single disease. There are different types of arthritis, more than 100 or 150 types of arthritis. So these can affect younger population like children, the middle-aged, elderly. So any age group can be affected. So different age groups have different types of arthritis. So in general, we have, arthritis in children called juvenile arthritis. And in adults, we can have inflammatory arthritis, in which we have rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, these kind of things. And then we have a condition called degenerative arthritis, which is because of age, there is wear and tear of joints and everything. So osteoarthritis is one form of it. And then we have other type of arthritis called crystal arthritis, where there is, increased uric acid in the joint, which causes inflammation. So gout, and, there is one more type called pseudo gout. So broadly, these are the, different types of arthritis which can affect an individual.
Thank you, Dr. Yogesh, for setting this introduction for this particular conversation. My next question will be for Dr. Anuj. Being an orthopedic surgeon, what are the common signs and symptoms that you see when a patient walks into your clinic who has been diagnosed with arthritis or who comes to you for this particular thing? And also talk about some key risk factors that are associated with developing or progressing this condition of arthritis.
Yeah, most commonly when a patient who is having arthritis comes with the symptoms of his pain and swelling in the joint, knee joint, swelling in anywhere, like whatever the joint is infected. Because of that swelling and pain, because he will come with that, and because of all the symptoms, like patient will got a in early stages he's got a difficulty in walking if his knees are involved, if his hips are involved, and like similarly there will be, if his hands are involved, there will be difficulty in doing his day-to-day activities with the hand. Depending on the depends on which joint is involved, according to that. And then there will be risk factors, like in general, if you can say, as the age advances, there is a higher risk of, you can say, osteoarthritis, there is a high risk of rheumatoid arthritis. Then in some cases, there is a genetic predisposition in some arthritis, like you say in osteoarthritis or in some kind of a rheumatoid arthritis also. Then there is a broad consensus, as the weight increases, there is higher chances of developing a arthritis in whatever the joint, you can say hip or knee. Then you can then there can be injury to the joint in any form, like some patient has got a sustained trauma due to the accident or is twisting injury to the joint that has damaged his stability of the joint, that will lead to an early arthritis. So
Right.
you have to prevent all this over. Then some most of the cases, in especially they say in arthritis develops because of the overuse of the joint. So you have to avoid all those things factors basically.
Right. Thank you, Dr. Anuj, for pointing out the common signs and symptoms as a clinician that you see. Moving over, Dr. Shah, my next question will be for you. As Dr. Anuj very rightly mentioned, that these are the common symptoms that we see in early stages of this disease. How do you feel early diagnosis impacts the overall treatment outcome that we see in bone health and arthritic related cases?
So, well, that is the most relevant aspect that we need to emphasize, that early diagnosis, because as we know that we are celebrating today World Arthritis Day, and the theme of last year was that come early and to diagnose early. Because as we know, if you are able to diagnose, if you are able to catch up these patients at early stage, then you can prevent the deterioration of the joint, so that the joint replacement surgery can be avoided. So it's very important and pertinent if you are able to diagnose these cases early, because it can avoid not only the joint surgeries, because you are able to put him on only fewer drugs. So that because if you are diagnosing him late, if the patient they are coming in late and the joints are crippled, then the the painkiller requirement and the other drugs requirement is further increased. So it's better to diagnose him early. So the most pertinent message that I would like to give with you, that if you have some problem regarding arthritis, then you should consult your doctor, because if you are able to diagnose at early stage, it will affect overall of life of your patient.
Right. Right. Very, very rightly said, Dr. Shah. Thank you. My next question will be for Dr. Yogesh. Dr. Yogesh, in your clinical practice, how do you generally go about diagnosing arthritis? Please educate us about the steps that you see as a clinician while you're making a diagnosis for arthritis.
Uh, it again depends of the type of arthritis what we are suspecting. So in general, the diagnosis of arthritis basically depends on three things or three steps involved in that. One is a good clinical history where we try to understand, what are the joints involved, and from the history, does the joint problem look like an inflammatory joint pain or a non-inflammatory joint pain? Then we examine the patient and try to ascertain what are the joints involved and try to confirm things what we find on the history, and subsequently we try to do some relevant tests which may include blood test, x-rays, and in the end of it we are able to come to a diagnosis. So it's not basically dependent only on blood tests, it's a combination of all three of these things. And most important thing is the history examination which guide us what test we have to do. And so it's a combination of all these three things which help us to diagnose what type of arthritis it is.
Right. Thank you. Thank you, Dr. Yogesh. Dr. Anuj, my next question will be for
Yeah.
you. So, given that as a clinician, as a rheumatologist, as an orthopedician, you have diagnosed that a patient has arthritis, what are some common management and treatment strategies that are used for managing arthritis at the root level?
Yeah, at the root level, whenever the patient comes to you with an early arthritis, suppose the patient has come to early arthritis with the pain and swelling of the joint and difficulty in his having function. So first and foremost is like you have to, as Dr. Yogesh has rightly said, you have to make it diagnosis what kind of a arthritis it is. Is it osteoarthritis or whatever the type of rheumatoid arthritis? You have to first label it as a what kind of a diagnosis you have to make. Then on the basic of that, basic medications you have to give, like NSAIDs, non-steroidal painkiller, basic NSAIDs you can give. Then you have to give to the rest. If it is an acute flare, you have to give rest to the joint. In the sense, then you have to keep the mobility of the joint. In the sense, you have to keep encourage the patient to do a regular exercise in the sense, so that there is no further deterioration. And then it depends on the type of arthritis. There are certain medications which are specific to a particular arthritis. You can give some disease modifying medications in some osteoarthritis or in rheumatoid arthritis.
Right.
And then you can give them some kind of a braces or some to prevent the further injury to the joint, so as to give it a rest.
Right. Thank you, Dr. Anuj, for elaborating these strategies for managing arthritis. Dr. Shah, my next question to you: being a spinal surgeon, shed some light on some recent advancements or innovation in the form of surgical treatment that we provide for arthritis. Any recent technological leaps that we have taken?
Yeah, right now we have lots of advancement in the field of surgical field. First of all, as we know, if the patient is having arthritis, advanced arthritis, because as in the first question that you asked, if you are not able to diagnose early, and the patient is having like advanced arthritis, and patient is crippled, that he is not able, he or she is not able to move just because of the spinal osteoarthritis. Osteoarthritis can affect lots of joint, any joint, like it can be like your knee, can be your hip, can be your spine. So as a spine said that you are asking me, if the patient is having osteoarthritis of his spine, then majority of my patients are managed conservatively. They are managed conservatively. But if they are not responding conservative treatment, then we'll put him operative surgical procedures. And right now, like fusion surgeries that we are offering this patient. So because of osteoarthritis of the joint, these joint need to be get fusion surgery, and we have like minimally invasive spine surgeries for this patient. So by virtue of this surgery, the patient are able to mobilize by the next day of surgery, even on the same day of the surgery. So that is the beauty of treatment for today with the help of minimally invasive spine surgery. This is in the field of advancement in the field of your surgical terms. But if you ask me like regarding what is the medical management, so
Right.
there are several aspects that we need to reconsider what kind of osteoarthritis this patient is having, and depending upon, because there is a gamut of treatment that is available. So first of all, the medical treatment, then afterwards surgical treatment, and it is basically reserved only for a like a small chunk of patient that they require. If the patient is having crippling arthritis or advanced arthritis.
Right. Thank you, Dr. Shah, for putting your light on this topic. Moving over to the next part, we had a patient. We understood that it was arthritis. We made a diagnosis. We spoke about the management strategies and the treatment modalities available. Now, for the people living with arthritis, Dr. Yogesh, my question will be for you. What coping strategies do you recommend for individuals to effectively manage arthritis in their day-to-day life and lead a fulfilling life? As a clinician, what do you suggest, and how have those things impacted the overall management strategies that you curate for patients?
Yeah, it's a very important question, Nishant, that how to cope with arthritis. So I think the most important thing in coping with any condition, be it arthritis, be it diabetes, be it hypertension, anything, is trying to understand the disease, what you have. So I'm talking more in terms of long-term inflammatory arthritis like rheumatoid, Angstbond, psoriatic arthritis. So the most important thing is the person should understand that he has this particular type of arthritis, which requires regular long-term treatment, which will require regular visits to the hospital to visit the doctor, getting regular blood tests done, entails or requires regular medications. That's the most important thing the person should understand. He or should accept that he has a condition which requires regular medical care. Acceptance is the most important thing for anything in life, which includes conditions like arthritis. The second thing is that they should, be taking regular medications so that the disease does not increase or cause problems. Another important thing is the person should understand that the initial 3 to 6 months of treatment are crucial, where there may be ups and downs, good days, bad days, where in the bad days the pains may increase. So they should understand they may have that, and so that they don't get too worried about when the pain increases. And the other thing is they should have some important, or they should try to have some leisure activities, which are important, which probably helps them to switch off or forget thinking about the arthritic condition. It could be anything. A person could like listening to music, reading books, doing gardening, anything. So leisure activity is very important. And other important thing is, I think one should have a good support system. The support system could be a colleague, could be a friend, could be spouse, could be a partner, could be parents, could be sibling, could be having a pet also. So I think these are the few things which I try to explain to individuals who have chronic arthritic conditions. So these are the strategies which may help them to cope with the condition and lead a normal, fulfilling life.
Right. Thank you, Dr. Yogesh. Dr. Anuj, as we have understood well that arthritic patients lack mobility, and this has some psychosocial and some psychological deficits that we have seen majorly in the more vulnerable, let's say the senile, the geriatric population. What are your views on this, and how do you feel that can these be tackled and combated?
Yeah, and you have rightly pointed out this aspect, psychosocial aspect, because as the age advances, the patient, those who were mobile earlier, very mobile, they suddenly start developing a lack of mobility, and then they feel they are like they cannot go anywhere in the social aspects also, which at that age also they want to interact with other people. So they have got some kind of a in their back of the mind, they start developing some kind of a, you can say, psychosocial effect called as depression or anxiety, you can whatever the name, you can, stress effect onto the patient's mind it comes. So that has been rightly pointed out. So it is very important to tackle that point also. You have to talk to the patient, reassure the patient. You have to make them understand the natural history of the disease. So, and you have to make sure that after some time, like with medications, with some lifestyle modifications, they will be back to their own mobility effect.
Right.
So, and if somehow, if some patient do develop that psychosocial effect, you have to start medication in consultation with a psychiatrist or a physician. You have to start medication for that.
Right. Thank you, Dr. Anuj. Dr. Shah, as Dr. Yogesh was just talking about support groups and resources, I'd like to pick your brain in trying to understand what kind of support systems or resources are available for people not just with arthritis or let's say rheumatoid arthritis or osteoarthritis, but people generally for their including bone health and arthritis. How much do you feel are the support systems and the resources necessary in the overall outcome that we see?
So it all depends how the patient is presenting to you. Because right now, because I am working in a government hospital, so I see large chunk of patients belong to a lower class and a middle class. So because they are, if we talk about certain group of medication like biologicals, they are very costly, so it's difficult for all the patients, but not every patient can afford that class of drug. So it's for that time we need some support, like from government support, or some like if you can ask me about the surgery. So it's very difficult for for a like a person to can afford a fusion surgery, even for the spine or a knee replacement surgery. Not all the patient can go for that. So I'm really thankful to our government right now that Aishman system program is running in our hospital, and certain other systems are available, programs are available that they are running, and from the government we are getting very good support. So you can initially it was not possible that the poorest set of people are able to afford this kind of surgical management, because right now if you can ask me in my own department that we are working like every week we are doing more than 10 to 15 joint replacement surgery, and regarding spine 2 to 3 fusion surgeries every week we are doing. So that is just because, and a big chunk of patient they are coming getting support from government. So it's very appreciable that the kind of work that this time we are happening in our system.
Thank you, Dr. Shah, for pointing that part out. Now, moving over to the next section, let's talk about the prevalence and the variation in prevalence that we see for patients relating to bone health and arthritis. I'll start this question with Dr. Yogesh. So as we know that there is a notable regional variation, there is a notable socio-economic variation, rural-urban variation for patients developing arthritis. What are your views, and how do you feel that this actually impacts the healthcare delivery that we see in India? Dr. Yogesh.
Can, so I mean, if I get the question correctly, you want to know, is there any difference in the type of arthritis what we see across different geographical areas,
Correct.
rural,
Correct.
urban,
Different
and
geographical
also,
areas, different socio-economic zones. Right.
yeah. So if you look at the type of arthritis, I don't think we have seen any, because I have, been in Bangalore for a long time, and then I've come to Dehradun about a couple of years ago. So I've practiced, where I used to predominantly see people who used to come from urban areas, to now where I see people predominantly from rural areas. So I don't see any difference in the type of arthritis or those kind of things. So the diagnosis part, I don't see any difference in either the rural or the urban population. What I see, but
And
yeah,
the
the
general
thing what I definitely
incidence, the general incidence, the change in incidence, if there is any notable change in incidence of, let's say, a person having arthritis in a rural population versus having arthritis in an urban population, is there a notable difference there?
I don't think so. There have been some data from India which was done by the what is called as COP code groups in India across
Mhm.
populations. So they have done in rural urban areas, and they have found that there is no difference in the rural or urban in terms of arthritis. Yes, there was some difference in terms of some conditions were slightly more common in the rural areas when compared to urban areas. In terms that what they found was that the risk of having osteoarthritis, especially, was slightly more in the rural areas when compared to urban areas. And so this was the difference what was found in those studies. So yeah, from that perspective, yes, individuals in rural areas, because of their more physical activity, more wear and tear, which may affect their knee joints, so they may be at a higher risk of conditions like osteoarthritis affecting the knees when compared to the urban population. Yeah, so that is the difference definitely that has been observed.
Right.
And what was the other question, Nishant?
Yeah. Sorry.
What was the other question?
My other question is, as you have mentioned about a subtle difference in the incidence of arthritis that do we see, how do you feel does it really impact the overall healthcare delivery if we talk about, let's say, urban versus rural? Is there some notable difference?
The There are a couple of things here. One is the awareness about lot of health conditions is much better in urban areas. For example, I have seen people who come to us within 1 week or 2 weeks of joint problems, symptoms. They come to us because they're aware that if this seems to be a joint problem, I need to meet a doctor. So the awareness about conditions is there. The health-seeking behavior is there in urban areas, educated areas. But when you come to rural areas, a lot of times you see people who come to you very late. The health-seeking behavior is not there. It partly could be related to the lack of awareness about health conditions, and also could be related to lack of penetration of our healthcare delivery system there. I think it could be related to both of these reasons.
Right. Thank you, Dr. Yogesh. Dr. Anuj, building on the conversation that I was having with Dr. Yogesh, do you feel there are certain specific challenges or barriers that exist in a certain demographic area versus not in the other area that in providing quality arthritic care, in your opinion?
Yeah, definitely. As rightly said by Dr. Yogesh, also there is a lack of maybe awareness and a lack of healthcare penetration into the rural population, or maybe area where the specialist is not available. So the mainly the treatment is given by a routine general physician who is giving all the treatment for all the specialty, not specifically for only arthritis. So he will be giving on he will giving a broad medicines like for broad care for the all type of medications. So that is, then there can the one more effect can which I want to mention is there can be because of the monetary, like sometimes like there is a less monetary effect can be seen into the rural population because of the less income, you can say. They are more reluctant to take come to the hospital also to take medications. They keep on prolonging their disease. That can be
Right.
one of the factor.
Thank you. Thank you, Dr. Anuj. Moving over, Dr. Shah, my next question will be for you. Through this medium of this virtual discussion on World Arthritis Day, I'd like to pick your brain in trying to bust some common myths and misconceptions that you would like to speak of to our viewers and amongst the panelists around arthritis and bone care and the different options available. Some common things that you have seen in your clinical practice which are completely misinformed, please.
uh, Regarding this is a very vague question, but still, like there are lots of things that happens like in our patient that used to come. What we need to like if you ask me regarding your spine, so many of the people they have like restriction, do not lean forward and sit straight. So we used to advise our patient these precautions, but this is not for the lifelong. Like I encountered a few patient, he was advised at the age of 35 that you do not leave you do not lean you should not lean forward, and from last 10 years he has not done that activity, so already he got stiff spine because of that problem. So it's because these like precautions are not specific for your whole life. And
Mhm.
there are several things like if you advise a few patient like do not squat for like knee osteoarthritis. If he's a younger age, then it is not for their whole life, but for the older age it's fine because they cannot because the joint is crippled, they cannot do that. So there are lots of myths, and if you ask me regarding particular question, then I can answer that myth. There are certain like I encountered like regarding my majority of my spine patient. So one is that that because of the arthritis, whether we are able to eat this thing or that thing not. So there are several things like if you are having like crystal arthritis that the doctor Yogesh was talking. In that arthritis, there are certain things that you should avoid because of the crystal arthropathy. They can increase, but not for the all of the arthritis. Because I encountered like a rheumatoid arthritis patient, and they are asking me whether we should eat protein or not. So it is not. It is absolutely required for that for their growth. They should not restrict this activity this from their meal. Dr.
Right.
Yogesh, you want to
Right.
point highlight
Obviously.
something.
Please, Dr. Yogesh.
Yeah. So, we see a lot of myths regarding arthritic conditions among general population, lots of them. One of the, I mean, myth or lack of awareness, a lot of people, at least in the area I practice now, end up with a neurologist with joint problems. So they come to us, we tell them, भैया आपको गठिया है, जोड़ों की समस्या है. तो they'll keep asking कि डॉक्टर साहब आप को पता है ये गठिया ही है, मुझे तो नसों की दिक्कत लग रही है ये. So that they're not aware that joint pain swelling is part of arthritis, not neurological problem. Then you have to explain to them that भाई नसों की दिक्कत है तो सुनपन होगा या आपको झंझनाहट होगी, इस तरह की चीजें. The other very popular misconception is people come to us, you tell them भैया आपको गठिया है, ये फलाना चीज है. तो then they'll tell us कि भैया डॉक्टर साहब मेरी तो उम्र ही नहीं है, मैं तो 25 साल का, मुझे कैसे गठिया हो गया. So this thing that arthritis is problem of old age. So then we try to explain to them that arthritis is not a single condition. There are different types of arthritis. Rheumatoid, ankylosing affect the younger population. So that kind of thing, that the age and arthritis. That's a very one more thing. The other thing is uric acid. Our India is consumed by uric acid. Sometimes I say India is on a mission to eradicate gout from India because everybody has any joint problems is asked for uric acid, or sometimes patient themselves get it. Like yesterday I saw rheumatoid arthritis. डॉक्टर साहब आपने मेरा यूरिक एसिड नहीं चेक कराया, कहीं मुझे वो यूरिक एसिड वाला गठिया तो नहीं. So people feel that any joint problem is uric acid problem. So that is one misconception. Then the biggest I think is परहेज क्या नहीं खाना है, क्या खाना चाहिए, मोटी दालें खाएं, चावल, दूध. So, these are the misconceptions which a lot of people have. The only way to resolve all of these things is obviously by increasing awareness and educating them, which we try to do when they come to us, but probably not sufficient. We need to have bigger platforms where we can get across our message to people. Yeah.
Right. Thank you, Dr. Yogesh, for adding to the question. So, building on the same, Dr. Anuj, my question to you will be, like Dr. Yogesh just mentioned, how do you feel can healthcare providers and communities step together and create awareness about arthritis at the grassroots level? How do you feel some initiatives that you're part of or some strategies that you deploy? Please help us educate about
Yeah.
this.
See, as Sir as Dr. Yogesh has already told, because there is a lack of awareness. So the first and the foremost, by building a collaborative effort with the community worker, like maybe in Anganwadi, as we use in gynecology ops for antenatals. So we can use those people also, and to guide to the people, those houses they are visiting, if they encounter any patient with kind of small kind of a joint pain or something like that, so they can always educate that patient to take an early help from a doctor,
Mhm.
to take proper guidance from the concerned doctor, so that they can prevent that joint from degrading further. And those some basic tips, like to increase the mobility of the joint, some basic exercises they can always tell ki you keep on moving your joint, so that not to as not to hurt also, but on the side by side you have to keep the mobility of the joint. So the basic exercise they can be taught. Then they can be taught to help the patients to decrease the weight, to make it in a comfortable weight limit. Then they can be promote to create awareness about the dietary, like to take a good food habits, maintain good food habits. So in that way they can be taught to, because these people are going to the regular houses. So these people can be taught कि at least basic information about prevention of arthritis you can convey to the community, so that whenever they can have an early symptoms also of arthritis, they can take the earlier guidance from the doctor.
Right. Thank you, Dr. Anuj, for pointing that out. Dr. Shah, being a spinal surgeon, having Dr. Yogesh being a rheumatologist, and Dr. Anuj as an orthopedic surgeon, I'd like to understand your views on the multidisciplinary approach and the collaborative efforts that the different departments of a hospital have a say in the arthritic management that we see. You can maybe comment from a more surgical and a more spinal surgeon side of it, and I'll have the rest of the panelists share their particular views subsequently. So, Dr. Shah, please.
It's a need of an hour, because no single specialist can deal all the problems, because what we require that we should have a musculoskeletal unit, and that comprises of multiple specialities like rheumatology department, immunologist. They are the must, because they should be able to make the diagnosis. And because whatever the problem that they come, first of all we need to make a diagnosis, and we should start up with the medical treatment. Then afterwards, the role of ours, like as an orthopedic surgeon or some spine surgeon, that comes, because if the joints are getting deformed, then they should be like make by virtue of surgery, you are operating that surgeon, and again providing a artificial joint to that patient, so that the mobility can be restored. Then afterwards, like the another thing, that the rehabilitation part, whether you are doing the surgery or not, there are certain group of patients that they cannot afford surgery, or that cannot fit for the surgery, for that rehabilitation. And even the patient that you have operated, they require rehabilitation part. So Department of Physical Medical Rehabilitation, they should provide a adequate physiotherapy, and how to live life, how to cope like the rest of the life with the crippled joint, whatever the joint condition that you are having. So like multiple, like radiologists says, there are several streams, but the most important that musculoskeletal unit that we should comprise rheumatologist or immunologist, then afterward orthopedic surgeon, and with different like orthopedic joint replacement surgeon, they can replace the knee and your hip joint. So whatever the arthritis joint that they are going to have, then they can be again restored with the mobility. Then afterward, this rehabilitation part.
Thank you. Thank you, Dr. Shah, for putting your views. Dr. Yogesh, a similar question in continuation to Dr. Shah. Please share your opinions about the multidisciplinary approach that arthritis requires.
Yeah, as Dr. Shah said, it's a multidisciplinary care where in case-to-case basis we need to collaborate with different allied specialities so that we provide complete care to the patient and then help in his or her recovery so that they can lead a normal life. You need to have a rheumatologist. You need to have, as Dr. Shah said, very good PMR department, physical medicine rehab, because a lot of these patients will require good rehabilitation to get back to the routine activities. And other collaborative effort may be required. We will also need good occupational therapists. For example, a person has hand deformities, so he needs to have certain different type of spoon to hold things. His grip may be different, so he may need implements or routine things which are used in the household may need to be modified accordingly. So we need an occupational therapist for that, so that that person can help the person lead a normal life in his or her home. And then in selected cases, we also may need the help of a good dietitian, so that they can advise them regarding appropriate diet, which may help them to manage their condition, appropriate diet to manage weight loss and everything. And the other thing sometimes we may require is the input of a psychologist, because sometimes people may have difficulty in coping with their illness. So definitely having a psychologist does help. And definitely, obviously, orthopedic surgeon has to be part of the collaborative care where his inputs are required from case to case basis. I think so. It has a combined effort where case to case we may need to collaborate with different our colleagues in different specialities.
Right. Thank you, Dr. Yogesh. Dr. Anuj, anything that you would like to add? I
Yeah,
think majority of the things
yeah.
are covered. Please.
No, definitely. One more thing I would like to add, because it was a multidisciplinary among the various departments, and like to add, most of the patients, irrespective of any type of pain, like either it is a back pain, or it is a any kind of a joint pain, or maybe a child who tends to develop spondyloarthritis and different kind of a arthritis. Most of the time they will approach irrespective of, like, they will not know whether they have to go to a rheumatologist even in the urban areas also. So they will go to a orthopedic surgeon. So it is a duty of an orthopedic surgeon or any other doctor, basically, maybe a physician also. Many times they go to a physician also. So it's a duty of the doctors, basically, if it is the case is particularly of a kind of a rheumatic problem. So they should refer to the appropriate doctor, maybe rheumatologist or maybe spine surgeon. Or whatever. So that's my
Right,
answer.
right. Thank you, Dr. Anuj. Moving over to, let's say, the last two parts of this conversation, I'll start with Dr. Shah. Dr. Shah, any recent technological advancements or advancements in digital tools that you feel are proving beneficial in the diagnosis, the management of arthritis and bone related problems in general, please?
So, like, I'm taking you on to ask what are the apps that are available.
No,
What
so the
exactly?
therapeutic, the digital tools that can be used for, let's say, a very spot on diagnosis or technological advancements that are coming out in the space of the management for arthritis, be it surgical, be it otherwise.
That for diagnosis purpose, lots of tests that were initially unavailable to the general population. So right now all these tests are available at the root level. If you can ask, initially if you can ask, it's serum uric acid level. If at the district level they are not available, but right now these are approachable to all the patient. And if we want to take an x-ray, initially it was not available at the district primary health centers. Even still it is not available at all But at the district health center, these technologies are right now available. If you can ask me, like all these patients are suffering from osteoporosis, so they require bone mineral density measurement by the DEXA scan. So these are available. Initially, like if you can ask me 5 years back, so it was not available for everyone. But right now, these things are available with the effort of our government system, with the efforts of our these senior people. They are making these things available. So right now, we are able to make a diagnosis for all these like complex problems. So it's easy for us. Like if you can ask me like regarding my spine patient, so initially like a CT scan, MRI, so all these are available to our patient very easily right now.
Thank you, Dr. Shah. Dr. Yogesh, my next question will be for you.
Can I add a
Uh,
couple of things to this?
Please, obviously, please.
Yeah. So I think one of the things in digital health has been, I think, post-COVID, more use of digital health, digital methods to treat the patient. So I think telemedicine is one thing which is very important, especially if remote monitoring. For as a rheumatologist, I need to monitor my patients on a regular basis. Are they taking medications? How are they doing? Are there any issues in terms that are the drugs causing any side effects? So I think from a digital innovation point of view, I think telehealth or remote monitoring is very, it is something which is good, where we're able to reach the people who otherwise may have difficulty in coming to the hospital. And there are a couple of other innovations which are going on. One of them is both of them from a diagnostic perspective. One of them is that ultrasound is being used quite routinely in rheumatology these days in a lot of centers around the world and in few centers in India also. So these days there are, but for ultrasound you need a machine which is expensive to use, needs space and everything. So there are a lot of efforts to develop handheld tools where you have an ultrasound probe and you can connect to your phone or or a tablet and then do an ultrasound. That is one thing which has been there. I think one company has already made it in USA. Hopefully, it should be available in India. Let's see. The other tools which are there is again, smartphone-based apps wherein they are trying to quantify the amount of inflammation in your joints in the hand. So you keep your hand below the phone and then, so they're still working on that. So like that, there are different digital innovation which is going on, and hopefully in the next 5-10 years, some of these we should be able to use in our clinic also.
Right. Thank you, Dr. Yogesh, for adding to the same. Now, what I wanted to ask you is for the general awareness of the public, any governmental or non-governmental organizations that are working in arthritic awareness and support groups that you're aware of, you're a part of, that you'd like to
Right.
tell our audience here.
Right. So, from the government perspective, we don't have much efforts going on. Actually, a lot of the rheumatological conditions are not part of insurance approval. Suppose somebody has rheumatoid arthritis, he can't get a new insurance policy. His old insurance, he can't renew it once he gets it. So that is the situation here. And a lot of the government schemes don't cover rheumatological conditions. So that is how it is. From a patient health groups or NGOs, there are lots of them which are doing good work. There is a society called Scleroderma India which works for scleroderma, Sjogren's India which works for Sjogren's syndrome, Lupus Trust India which for lupus, and then there are lots of ones which work for arthritis also. We have got MIA, Mission India Arthritis, Ankylosing Spondylitis Society. So all of these self-help groups are there which are working to increase awareness about this condition. And if uh, they are able to, these are people who can definitely help us to change a lot of the things which is, maybe if they can put pressure on the government so that the rheumatological conditions are covered under insurance and everything. So a lot of groups are there which are doing very good work to increase the awareness about these conditions. And I do work with some of them on a time-to-time basis to increase the awareness, especially Scleroderma India or Lupus Trust India, these organizations.
Thank you, Dr. Yogesh, for educating all of us about those support groups and organizations. Dr. Anuj, as we move towards the last part of our discussion, my question, I'll start with you. Any preventive measures that you suggest for individuals to reduce their risk of one, developing arthritis, two, slowing the progress of arthritis?
Yeah, and that's all basically all included the prevention of arthritis, you can say.
Right,
So prevention of arthritis involves basically reducing your risk factors. First of all, the foremost risk factor, as we say, we don't have any control over the age, but definitely age, as we say, age is a number. So what we can do is to prevent that coming into the mind is to keep your joints fit in the mobile in the form of a certain exercises like walking. You can keep it, swimming, and cycling. These are the very good exercises to keep your joint supple and mobile, so they will not put a much load on your joint, but in due course, but they will keep on improving your joint health. Then you have to prevent your injury to the joint, like you have to prevent overuse of the joint, prevent any trauma to the joint. Then reduce the weight. By reducing weight, you will decrease much load onto the joints, so that joints will have got more life. And uh, you can say I have got a good diet, healthy diet basically, so that will also keep your system good for your joint. And then to in associated with arthritis, there is some kind of osteoporosis also you do develop. So to prevent that also, all these factors like regular exercise, and these will help. They say there is a, like, if you do a 150 hours, 150 minutes per week also of exercise, that is very good for your joints to keep it working.
right. Thank you, Dr. Anuj. Dr. Shah, Dr. Yogesh, an open question to both of you. If you'd like to add to some preventive measures and strategies as described by Dr. Anuj. We'll start with Dr. Shah. If you'd like to add some preventive measures, please.
Like the most important, Dr. Anuj said, it's a healthy lifestyle, your balanced diet, and your proper health checkup. If you are at the age of 40s, then you should take a proper yearly checkup so that all these things can be preventable, because prevention is always and always better than cure. So
Right.
my message with your talk is that just adopt healthy lifestyle, do exercise regularly, and get a checkup yearly, so that we can prevent any sort of these problems.
Thank you, Dr. Shah. Dr. Yogesh, your message and the preventive measures that you would like to suggest to all the viewers now.
Yeah, I think it's important to understand that arthritis is not a single entity. There are different conditions in that, and from a preventive perspective, I think it is important predominantly for osteoarthritis, where having a healthy lifestyle, managing your weight, regular exercises, preventing joint injuries, and all of these things are very, very important. Regarding inflammatory arthritis, a lot of these have you know uh, the cause being multifactorial, wherein it is genetic, environmental, and other factors. So in them, lifestyle may not be as important as in osteoarthritis, but still in a lot of these inflammatory arthritic conditions, smoking or tobacco exposure has been an important risk factor for disease causation. So I think it's very important that people stay away. I mean, apart from having a healthy lifestyle, healthy diet, exercises, preventing injury, the one of the things which can reduce the risk of inflammatory arthritis would definitely be avoiding smoking tobacco in any form. I think that is one thing which I would like to add to the already discussion that has been done.
Okay. Thank you, Dr. Yogesh, for your addition to the measures. So with this, I'd like to bring this session to a closure. Any parting message that any of my panelists would like to give to the audience on this World Arthritis Day? It's an open question. Before I speak the closing remarks. Yeah.
I think all of us can give one message, starting with Dr.
Yeah,
Anuj, Dr. Shah, and
So
then I
please,
can
please,
give.
Dr. Anuj.
we will emphasize again regular exercise, regular exercise, regular exercise.
Right. Dr.
And I
Shah,
would
please.
like to, yeah, thank you. I would like to say that if you have problem, don't hesitate to consult your healthcare provider or your doctor, because if you are able to diagnose it at early stage, you can prevent further advancement. That is very
Right.
pertinent.
Thank you. Thank you, Dr.
Yeah, I
Shah.
think.
Dr. Yogesh, please.
Yeah, I think Dr. Shah and Dr. Anuj have already kind of put the message together that don't delay. If you have symptoms, please get in touch with your healthcare provider and try to maintain a healthy lifestyle. We want to, reduce the risk of developing osteoarthritis. I think that will be my message too.
Okay, okay. So with this, I'd be bringing this particular panel of discussion to a closure. I'd like to thank firstly all the viewers who have engaged with us and spent time in understanding about the different aspects of arthritis. Secondly, I'd like to thank Pfizer for powering this particular initiative, for stepping up on World Arthritis Day, and most importantly, I'd like to thank my panelists, Dr. Shah, Dr. Yogesh, and Dr. Anuj. Thank you for taking time out of your busy schedules and stepping up with Voice of Healthcare in creating awareness for this much important and impactful topic. So thank you and have a good evening, gentlemen. Thank you.
Thank
Thanks,
you,
Thank you.
thank
Amisha.
you, thank you so much.
We would like to have thanks to Voice of Healthcare also for giving us a chance to speak on this
Thank you, sir.
platform so that we can convey our message, we can create awareness among the patients. I'd like to thank Dr. Shah also, Dr. Yogesh for a very nice interactive session.
Thank you,
Yeah,
sir. Same here.
Thank
I
you. Thank you.
second Dr. Anuj's opinion. Thank you, everyone. Thank you.
Bye
Thank you,
bye.
sir.
Thank you.
Thank you, sir.
Thank you,
Bye.
everyone.
Yeah.
Thank you.